So let's go over the three main types of eating disorders that are very common to people today, which is anorexia, bulimia, and binge eating. Can you walk us through those quickly?
Sure. So starting with anorexia, this is probably the eating disorder that has the most grasp on public knowledge because we've had so many. We were talking before we got on air about some of the famous cases. And so with anorexia, we see an extreme fear of weight gain, negative body image, restricting calories, restricting to the point where they're not meeting their needs. And so that's really what we see with anorexia. And the diagnosis is more complex, but I want to give just a quick overview of it. With bulimia, what we see is this transition between engaging in overeating and binge eating and compensatory behaviors. And so there's this cyclical pattern that happens with the diagnosis. And
Can you chime in on that compensatory behavior a little bit?
Yeah, so compensatory behaviors like over-exercising.
Exactly.
Laxative use and purging, right? And so they go through periods of restricting and overeating and then engaging in some compensatory behaviors to make up for some of the other behaviors that were going on.
And then binge eating?
So binge eating, which is actually the most common eating disorder of the three. Yes.
I thought it was going to be anorexia.
I know, a lot of people think
Look at that.
Yeah. So with binge eating disorder, really there's a lot of things that happen with food. Usually these individuals are eating in secret. They're eating in private. They're eating large amounts of food. They're eating it quickly. And like in bulimia, there's this sense of loss of control with their food.